Okay, we need one last talk before we go out to eat tonight. And it has to be about food. So I'm pleased to introduce you to Leanne Burns. She's a registered dietitian here at Ochsner and LSU, and she is going to tell us about how to choose the best diet for a neuroendocrine tumor patient. Leanne.
Can you hear me? All right, we got that. All right, I want to thank y'all for having me, and there's a big crowd still left this late in the day. So for this, everybody want to stand up a second, feel welcome to. Many of you know that I'm used to people running in and out of rooms, because as dietitians, that's part of what we do, is get used to people having to go around to different restrooms throughout wherever there may be. So, but today I wanted to take time just to teach. We're going to talk more about foods. Many of you may have heard me talk about different symptoms and causes. But today we're really going to relate just to things that really apply to how to select the right foods for you. Am I doing it? Oh, here it is. Here we go. All right. What we use as our basis for choosing foods through all Americans is what we call the Choose My Plate, and this can be found on any website, choosemyplate.gov. And this is the golden rule for everybody that is in this country at this point. We've made a few revisions over this last year and have new guidelines that came out in January. But when we're working with neuroendocrine patients, we have to learn to modify these to help depending on the symptoms that you may have. So today we're going to go through a little bit about how to select the changes that you may have to make that makes your diet very special to you. Everyone is different. There's not one. I wish there was. I could tell you there's one diet for every y'all in this room to follow, but it's not that easy. We have to select according to your symptoms and your medical history and risk. First of all, people come into our clinic, they have other pre-existing diseases. So you may already be a diabetic, you may have high blood pressure, you may have had kidney disease before this ever became a part of your life. You may now or have developed fatty liver. There may be obesity that's been part of your life for a long time, or something that may have occurred later in life. You may have previous surgeries, and this plays a big part in how we plan your diet. And also partial obstructions of your bowel, and Dr. Boudreau discussed some of that earlier. Based on the types of tumors and symptoms is how we just select the type of foods that's probably, or the consistency, or how we're going to cook those foods to make it easier for your body to absorb the nutrients it needs to, so that you can maintain a healthy weight and keep the symptoms that occur to a minimum. If you have no problems, if your diet is, if you're normal, you have no problems with your digestive system, or you're not having flushing occurrences, then just stick to the guidelines of the Choose My Plate. But for those that see me, most of the time, that's not the norm. So we're making many changes to your diet because you have the digestive problems that exist. Some of them may be nausea and vomiting, which may occur, especially if you've been put on a chemotherapy drug. Diarrhea, and we'll talk a little bit more specific about that because that's not one word that describes everybody, but it's used in literature. Steatorrhea, which is a fatty stool, much like diarrhea, or constipation. You may have carcinoid syndrome or flushing. You may have hyperglycemia, and you may have fatty liver. And these will all change the way that I will select a diet for you. So we talked a little bit about diarrhea. Some of the causes of diarrhea, some short bowel syndrome, means that somebody's gone in, like Dr. Boudreau, and has removed part of your bowel. Sometimes this has happened several times throughout your length of your disease. And this makes the ability to absorb nutrients in a reduced surface harder to do. And we sometimes consider patients with short bowel having what is related or called dumping syndrome. You may have inflammatory bowel syndrome. Just this doesn't necessarily have to be because of your carcinoid. You may just have been someone that has had these type of troubles and have an inflammatory effect in your bowel can occur for different reasons. You may have celiac sprue, again, not related to your carcinoid. It's just part of your medical history, but can cause diarrhea. Pancreatic insufficiency, and if you've come to see me, you've probably heard that term at some point. Many times the things that keep the pancreas from releasing enough enzymes to digest your foods can occur, and we have to make special accommodations for this. Intestinal surgery. I work with Dr. Boudreau. You've seen the statistics. This is many times what I'm doing, either getting you ready for a surgery or helping you after you have had a surgery in our facility or in somebody else's. Gallbladder removal. Many times when they go in, they're going to take out your gallbladder because of the risk of the therapies that we need to use. Bacterial overgrowth. If we take you for a long time, and especially if we've had you without food, what we call NPO, nothing by mouth, for a long period, many times there's a bacterial overgrowth in the intestine, and this in itself can cause an infection, and an overgrowth can cause the diarrhea. Bile salt colitis. This is due to the bile salts seeping into the intestine unabsorbed. Drug-induced. The somatostatins that we give you to treat your disease can cause diarrhea as well. Your diet should be healthy. Everybody, all Americans, except for when you're in New Orleans, are supposed to be on a healthy diet. You should eat a diet balanced, low in fat and sugar. So I'm going to go through some of the specifics with you because these are some of the things that really make a difference in how well you may be able to tolerate your diet and your selection of foods. First of all, protein is very important for your body. It helps heal your body. It helps maintain the organs that are very important for our survival. And we want to give it to you in amounts that you can absorb. But we know from history and from working with patients that if you consume large amounts of protein at one time, it may make your syndrome worse. So what we try to do is give you smaller portions of protein in smaller amounts throughout the day. Most patients that see me, I will ask you to try to get 2 to 3 ounces, which is about the size of the palm of your hand or a little smaller, and do that for 3 meals a day. And 1 to 2, which is about the size of your thumb, amount of protein or meats or choices of protein in snacks throughout the day. I usually try to give you 5 to 6 feedings throughout the day as well. There's many good forms of protein. There's very myths. There are quite a few myths. The American Institute of Cancer Research has put out more information that is very sound than anybody else that's doing research. And they have determined that for all Americans and everybody that we come in contact, you can eat red meat. But we try to limit this to 18 ounces or less in a week. That way we don't increase your risk of other types of cancer, colon cancer in particular. Some forms of protein, and red meats can be beef, lamb, or pork. And I know that they say pork, the other white meat, but it's really not. It's really a red meat. Poultry, eggs, and egg substitutes are wonderful sources of protein and the easiest for you to absorb many times, although they can be a little gassy, so depending on your symptoms, the amounts can maybe have to be reduced. Fresh fish is one of my favorite things to ask people to consume because it's very easy for patients usually to chew and digest. But remember that if you're having trouble with fat malabsorption or steatorrhea or a stool that floats, then if you eat salmon or you eat fatty fish, they're still in the fat group. Although they're very cardiac healthy, they may still cause a little bit of your symptoms. Wild game. I come from an area in Louisiana where many people hunt, and we have venison and game birds as a big portion of our meals. And these are all very lean and very healthy. So those are also allowed in your diet. Quinoa, which is really a seed, almost in the grain group, is a total protein. And for those that are not eating meats and are maybe a vegetarian, this is a wonderful choice. And I really encourage the use and the exploration of diets with and recipes with quinoa. It's a real easy and healthy food. Lentils, soy, nut butters are also very healthy, especially if you can tolerate the fats or taking medicine to help absorb the fats. But we do have some of the nuts, dried beans, especially red, black, and pintos, that can increase your diarrhea output. I saw them out on the table with one of our speakers, and that was demonstrating, and I was a little concerned because I didn't listen, but do remember that some things that are healthy in other arenas are hard to absorb for my patients, and carcinoid symptoms and diarrhea are increased when you eat these foods because you insoluble fibers, which is the outside of the beans, also in the peels, and we'll talk more about that, of fruits, can increase your diarrhea output, stool output. We use these foods in prevention because we want to get things through your intestines in a rapid fashion. We do not want these to sit in your intestines for a long time. But if you have diarrhea, we need to do the opposite. We need to use foods that will slow down your transit time or slow down the length of time it takes for foods to get through you. Fresh seafood is wonderful, unless you're having some type of seafood allergy, which we would tell you to avoid it. It also is a good alternative and a very lean meat. An alligator, which you may not get anywhere else in the country, is also very lean meat, and you may have tried it while you're down here. Everybody will say it tastes like chicken. It doesn't. It doesn't have the texture of chicken either. Grains. This is where you get your energy. This is your gasoline that runs you. Very important. This is your best energy source. We try to get most of your carbohydrates in a complex carbohydrate form, which are your whole grains, oatmeals, wheats, breads, starches, cereals. Some of the starchy vegetables, peas, beans, are also in this group. In a normal diet, we try to get as much as 35 grams in your diet daily. In a patient having diarrhea, we may drop this down as low as 13 grams per day to keep you from having complications of rapid output or obstruction of the GI. We want these to be higher in soluble fiber, and for those that remember several years ago when soluble fibers came on especially on the market of food as heart healthy, the oatmeals and the insides of the fruits and vegetables. These are the types that are easy for your body to absorb and has a good absorption of water content and very unique, and helps actually the colon reabsorb water. So we try to use these, but we try to have you peel the fruits and remove the hard areas. There are some, again, that we try to keep you away from, which is corn, because it's very hard to digest, as well as the beans. Non-gassy for patients that are post-op and also with gas problems, because gas formation can make your stomach bloat, make you feel very uncomfortable, and after surgery, it can make you really increase your pain. So there is a diet that was put out on the market. It's called the FODMAP diet, and it's been used for irritable bowel, but many of you may have received one just so I can show you a demonstration or an explanation of the foods that cause more gas and things that cause less gas. But for the most part, many times we call these the cruciferous vegetables, and we'll talk a little bit more about those selections in a minute. So if you have a low-fiber diet ordered, that means that you should keep your diet down around 13 grams a day. And if you're at risk for a partial obstruction, or if you've had several GI surgeries where we're worried about things getting stuck or adhesions, we usually will drop it down as well. Again, some of the sources of these, I wanted you to be able to look so that you know. Everybody always says, I only give out white foods. But really, there are more choices than just white foods, and we'll talk more about some of those. But many of these are white, and it's because they're easy for your body to absorb, and they give you a good energy source. And these can be the quinoa we talked about earlier. It's also a carbohydrate as well as a total protein, and it's very wonderful in a diet. So I encourage it, and have written some recipes in this as well. Potatoes, but this time we're going to take off the peels if you have diarrhea. If you don't have a diarrhea, you can use even the sweet potatoes if they're a little bit gassier and they have more fiber, but they can be used in the diet. Rice, we choose white if you're having diarrhea and high outputs. If you have a normal GI tract and you have no problems, it's great to use the brown. But remember, if you're having diarrhea, that white rice can be the difference between finding a food that's easy to absorb and those that are not. And for some of y'all that tasted the electrolyte replacement that we have, and I think they'll do it again today after this, it is a rice milk recipe where I combined white rice, and there's really reasons for that. We used it many years ago as a way to control diarrhea. You may have heard of the Brat diet of one time. And we used it a lot in pediatrics to be able to give electrolyte replacement and a way to reduce the output of diarrhea. And it's still very useful today. I have a way you can make it at home. And I have usually add a fruit pectin to it so that it gives, fruit pectin also has some great absorption factors we'll talk about in a minute. But these things combined not only just increase flavor, but actually increases your soluble fibers. Pastas are wonderful. If you have problems with digestive issues, then let's stick to the white ones. If you have glycemic, if you're diabetic, if it's not cooked all the way, al dente, it actually has a lower glycemic index. So that may be beneficial. And if you're diabetic and it's real severe and you're not having problems with your GI tract, I really encourage the whole grains in the pastas as well. Couscous, breads, if you're having diarrhea, keep the ones down to around 3 grams or less. But you have to be careful with the 9 grains and the ones where you see the seeds and the nuts and those that are a little bit too whole, too many whole grains. You may also find that with pumpernickel and rye. Cereals, whole grains. Well, oatmeal's a whole grain and it's a soluble fiber and can work very well in your diet. So we encourage that in Cheerios. I don't usually name brands, but just one that you'll understand without me trying to describe it. Rice Krispies, again, I don't usually describe, but it's just, we all know what it is. Those are a little bit easier to absorb, and we usually try to keep you off of the real heavy brands and wheats, shredded wheats and things like that, because they can increase the stool output. The reason they're good in prevention, and for people with good diets, with no problems with the GI tract, those things are wonderful. But in the arena where you have diarrhea, those things need to be reduced. We also want you to use just read the labels and just look for those grams of fiber in there, and that will help you. But some of the ones that, just so you'll see, that are really absorbed easy are the oatmeal. We're in the South, so we use a lot of grits down here. And in that form of corn, you can absorb it. And cream of wheat, which is also high in iron. Fruits. Sometimes they'll say, don't ever eat the fresh fruits, and really that's a myth. But we know that it's the aging process that fresh fruits that actually can cause some of the syndromes. So we want to have fresh fruits that are very fresh and not overripe. These things can increase flushing syndrome, as well as the peels need to be taken off these if you're having trouble with diarrhea to reduce the diarrhea output. Canned fruits are fine. We prefer them to be in their own juice. Again, for all Americans, we try to reduce the amount of sugar and syrup intake, and so this is something that we encourage for everybody. And if you're a patient where you're having short bowel syndrome, or you've had many surgeries of your GI tract, or you have high output diarrhea, you want the ones that do not have heavy syrup. You can strain them and drain them off, the light ones. If you're drinking fruit juice, it's better to dilute it. That way you don't it's not so concentrated, your body can absorb it in a better fashion. High sugary output intake of drinks, including fruit juice as well as colas, will also increase your diarrhea. There's just some examples of some of the fruits that are very good for you and easy to absorb for the most part, and those are strawberries. Most melons, really with the exception of watermelon, if you're having trouble with fiber or glycemic index for diabetes, the watermelons have very high glycemic index. But if you're eating a wedge of watermelon, it probably is not going to cause you any trouble as long as you don't swallow the seed. But don't sit and eat a half a watermelon, which tends to be a lot of what the patients like to do, or myself as well. Nectarines and mangoes. The nectarines, if it's a thin skin in segments are very easy to chew. You can tolerate those. And mangoes can be used. And this is just an example. Some of the fruits that we know that can increase syndrome are overripe bananas and raspberries as well, probably for the fiber effect. Some of the ones that are really high in fiber are pineapples, watermelon, dried fruits. And so if you're having diarrhea, try to keep those down to a minimum to prevent obstructions or high output diarrhea. Vegetables. If you came to my demonstration, you saw everything was chopped very, very fine. It's very important that you chop, and if it's something that's very fibrous like celery, you peel it first, and then you chop it as fine as you can. And still, it's a little better if you cook it, or at least weep it with fluids. You also want to, that's for diarrhea and obstruction. You also want some of the starchy vegetables that have high fiber, or the corn we talked about earlier, the dried beans, especially red pintos and black. Frozen or canned, as long as, I'm not against canned foods. Some dietitians will tell you never to eat them, but we live in the real world, and some of us have to have storage where you can keep things over longer periods of time. But do try to choose the ones that say no salt added, especially if you're hypertensive. And try to cook your foods to a little softer condensity if you're having poor digestion, or you may even do better with something that's pureed or broken down naturally, like mashed potatoes or something in that area. And I even have done recipes through the years to break down things all the way to a soupy consistency, especially after surgery when things may be a little harder to digest as well. The gassy vegetables that we talked about before, we call cruciferous, are the cabbage, cauliflower, broccoli, Brussels sprouts, and onions. But you can use chives to get that onion flavor, or the green part of little green onions, and still get a lot of onion flavor without having the gas development that the onions can cause. We want you to choose low-fat dairy. Milk is fine. Try to keep the fat down to 1%. That's for all Americans. But if you're having trouble with fat, it's very necessary. Soy milk's okay, if that's something that you prefer, but do the ones that have no sugar added. The rice milk we've already talked about. Almond milk, just as long as it has no sugar added. The yogurts are fine, as long as they're low fat. Do better to have the ones that are plain and then add fruits to them versus have the ones that have fruit in them, just because they usually add a lot of sugar to these as well. And you can use low-fat sour cream. Lactose-free products are on the market, and pretty available these days. And for those that are lactose intolerant, these really make a difference in whether you can choose a dairy or not. Low-fat American cheese can be used, and they do not cause syndrome. Many of the aged cheeses, most of the other aged cheeses will cause syndrome. If you're having carcinoid syndrome or flushing, you'll need to avoid these. But you can use low-fat cottage cheese and low-fat ricotta, and these are very helpful when you're trying to make sauces and use things that are flavorful. But as long as you keep to really small amounts, just remember many times it's the amount that you consume, and that really is the overall picture. Low-fat, sugar-free ice cream, because everybody wants ice cream and very few people absorb it if you're having diarrhea issues. Sherbets and sorbets are okay for those that are that are just having trouble with fat issues, as long as you're not having trouble with sugar issues. If the sugar is a problem due to diabetes or because you have a high output short bowel, then those probably need to be avoided as well. Fats. Fats are not bad. We all need a little bit of fat. Sometimes we have to give you a medicine to digest the fat. But a serving size of fat is a teaspoon, except for in New Orleans, where we use quite often would start out way above that. And that's the reason it's hard to digest some of the foods that you may get in the restaurants down here. If it's a light butter, it just means that that butter was whipped in air and ice, and so it can go further, and you can get a tablespoon. But try to avoid the deep fried. That's really where we get into real heavy fats, and they're very hard on the digestive system. There are a few other foods that are healthy, but they're fats, and those are avocados and olives. Cheeses that are light usually are a little bit tolerated just because they've taken some of the fat out of them. And then butter-flavored powders can be helpful, and there's several still on the market, and they just gives you some of the flavor without getting the fats in there. And they're usable. Some of the healthy fats we talked about already can be good for the heart, but again, remember that they may cause the fatty stools, the steatorrhea. Beverages, we want you to get your fluids in, 6 to 8 8-ounce glasses a day. But if you have diarrhea, try to keep the serving size at about 4 ounces at a time, and try to sip it slowly throughout the day. We do think that you'll do better if you consume your fluids 30 to 45 minutes prior to your meals and just sip a little bit of water with your meals. It actually reduces the transit time of the meals. Keeps you from getting too full too fast as well, and that way we can get more calories in you. Water and flavored water without caffeine or sugar are preferred. Diluted juices, if you're going to use them, is the same thing with sports drinks. Decaffeinated or sugar-free if you're having trouble with diarrhea, and non-carbonated drinks if you're having gas or diarrhea are the best selections. Seasoning, I really like you to use a lot of the natural seasons, the basil, the oregano, dill. Any of the lemon grinds are very flavorful, have a lot of really good healthy items and antioxidants. So these things are really encouraged. But the ones we want to be real careful with are the things that are hot to the touch of your tongue. Spices, you can use cinnamon and nutmeg, and they are very helpful. But just again, remember that some of the powders, such as onion and garlic, may increase your gas, so be careful when you're using these. And again, avoid the very hot foods when you're having carcinoid syndrome, and they'll increase your flushing syndromes. Food preparation, it's best to bake, broil, boil, braise, saute, grill, but try to avoid the direct flames. And that's really for all Americans because it's the darkening or the blackening of meats that increases your risk for cancers in the GI tract, especially the colon. Avoid raw when your immune system is down, especially after some of the procedures or you're on a chemotherapy drug. Make sure that you separate and keep very good cleaning mechanisms so that you don't get foodborne illnesses, because these, of course, will cause diarrhea as well, and it can put you in the hospital very quick and dehydrate you. And make sure after you finish cooking things that you store them appropriately and quickly, and try to avoid long times outside of the refrigerator. So use meal plans for your symptoms. Avoid the aged cheeses and fermented foods, because this is what the cause of carcinoid syndrome is. It's the aging process and the fermentation in foods that increase your syndrome. It's the release of enzymes in that process. Avoid meats and fruits and vegetables associated with syndrome. Some of these we've talked about already. But it's the smoked or the aged or the sometimes even pickled meats are going to do this. Avoid MSG. I think that the most of our patients, well, you can flush from MSG whether you're a carcinoid patient or not. We know that's kind of got its name. These Chinese MSG was related to syndromes or flushing in people way before we knew anything about carcinoids, but I do think it plays a big effect in this disease as well. And avoid alcohol beverages. Meal planning, try to make a grocery list appropriate for your symptoms. Don't wait till you get there and then decide what you're going to eat. Take time and do that. Sit down. Most people eat about the same foods every 3 to 4 days. And sit down and so you can select and put things in your pantry that are going to be good for you and make the challenge of buying and selection much less. Doing this in about 3 days, as we said, this helps. Know that what you're going to eat the day before. If you wait till you're hungry to select your foods, especially if you're trying to diet, you'll make the wrong choices because fried chicken smells a lot better than baked. So make sure that you know what you're going to eat the day before. That way you don't have to make the hard choices. Store foods after it's prepared. Try to do this in serving sizes so that for future meals, so that they're easy to take down and prepare and keep your struggle for just timing things down. And avoid leftovers. After 48 hours, they should be thrown out. So what I'd like for you to do is to choose small, frequent feedings from a variety of all the food groups. We want a rainbow of foods. We talked about everything being white, but remember, we have things like beets that have deep purple in them, and we have winter squashes that were deep oranges. These are easy to absorb, usually by the body, and give you a lot of color. And fruits, we have quite a bit in those selections that can be used as well. Medications, you need to take these as they're ordered to improve the symptoms, to increase your absorption. Make sure that you ask questions. If you're not unsure of how you're supposed to take some medicines that may have been ordered to decrease the transit time or to help you break down the fats or to absorb the bile after gallbladder surgery, make sure you understand how to take them. They need to be taken prior to your meal and not just any time during the day. So in a summary, most meal plans should be adequate for calories. We want to make sure that we have enough so that you're not losing weight. For most people that are not having too much trouble or losing a little weight, we can do 16 to 2,000 for most women. If you're losing weight, I'll add up and 500 a day. And men are usually around 2,000 to 2,400 is plenty. Increasing, if you're losing weight, we add 500 calories per day. And if you need to lose weight, we decrease it by 500. And the reason that is for 1 pound of body weight is equal to 3,500 calories. So if we increase it or decrease it by 500 in 7 days, we can make an adjustment of 1 pound. So in conclusion, just as zebras have different stripes, patients living with neuroendocrine tumors may have different nutritional needs. So be sure and see dietitians trained in neuroendocrine tumors, or request that your dietitian consult a specialist that knows how to treat this disease. Because even in oncology, and as an oncology dietitian I'm getting old, I have to say that 26 years of oncology nutrition, if you're not taking care of neuroendocrine patients, then you're going to take care of this in a different fashion. I want to thank you again for having me. Appreciate it.